At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center. Hello, everyone. Welcome, our Facebook followers to MedsPLUS Medical Minute Live. As you know, February is Heart Month. Yeah. And today we have a special guest with us today. We have Carolyn Etheridge with us today. And we are continuing our conversation about protecting our hearts and protecting our community. We are so excited for her to be here. And I'm going to let her introduce herself. She has many things going on in the community. And before we get into the education piece, Carolyn, tell us a little bit about yourself.
All right. Good afternoon, everyone. Like she stated, I'm Carolyn Etheridge. I first have been a healthcare provider. I've been in healthcare 19 years. First as a registered radiologic technologist and as a registered nurse with a focus of cardiac. My background stems in cardiovascular imaging as well as heart failure, cardiovascular disease, CV surgery, and what I love the most, cardiac cath lab.
Yes, we hear many stories about that.
Yes, I missed it.
Yes. So this perspective and us understanding your background, because it's so important that everybody understands your depth of knowledge as we're focusing on the Heart for Heart Month. So thank you for sharing that. So let's talk a little bit about heart health in our community.
Yeah.
From your experience, who is most at risk right now?
I would say our African Americans, that being male and female, because some individuals don't take it as serious. You know, when we get diagnosed and they tell us to monitor and document our blood pressure, you know, that's something so minor. We fail to do that and not solidify the importance of where that can lead us. And I think we don't hear a lot of education on starting from high blood pressure, where that can transition and take our bodies to. So I would definitely say it's the leading cause of death within the United States. So most definitely it's affecting our communities in the African American community. And It doesn't affect just elders.
Right. Okay, so are there risk factors that you consistently see in patients who have come into the hospital?
Yes, most definitely. So with some individuals, they kind of overlook it. They kind of toss it to the side and feeling like, well, I felt this before, it went away, or it didn't last so long, or this chest pain didn't feel like this the last time, or it's indigestion. Like I stated, they know they've been suffering from high blood pressure, but after 1 week, it went away, so they don't follow up on it. People that's not managing their diabetes well, they don't realize how that can connect to the cardiac system, to our heart system, how it could affect our arteries and vessels for long-term degenerative disease process to make things worse. Not really taking our medications. Again, going back to, I feel okay. I know you're looking at me. That's me. I'm feeling okay today. I don't have to take my medicine, not being consistent with that. Again, not realizing the long-term effects. And how heart disease, having congestive heart failure, right side, left side heart failure, that education, and cardiac arterial disease. Those would be some of the areas that we definitely hear a lot of talk about, but people really just overlook those things. But smoking, obesity, vaping, inactive physical activity, and stress, believe it or not.
Mm-hmm. Yeah, I think you kind of summed up all of the risk factors very well. I will go back to one thing you said that I don't think a lot of people understand that connection. Actually, a couple, but one is when you talked about people with diabetes and not controlling their blood sugar. Because I like to look at diabetes as a blood vessel disease. Mm-hmm. Anywhere your blood vessels can go, which all of the major organs, extremities, etc. If your blood glucose or those blood sugar levels are not controlled over time, it's going to affect our major arteries,
Mm-hmm.
our major organs, kidneys, heart, all of it. So I love that you tied that part in, and also that you see that on the hospital side, people not taking that medication every single day, understanding the underlying risk that you have by not taking it. It can develop into a more serious condition faster, quicker, harder, stronger. So much so we're clutching that chest. So, yeah. Okay, so next we're going to segue into, oh, and the second thing I was going to say, I'm sorry, blood pressure.
Mm-hmm.
That is one that we have been the most miseducation about around patients we come in contact with as well, is knowing that blood pressure number.
Mm-hmm.
Blood pressure number is so important. And we have patients that take their blood pressure, they get, for lack of a better word, accustomed to that high number,
Yes.
not knowing that it should actually be lower than that.
Mm-hmm.
So, yeah, we're seeing some of the same things with that. So with the blood pressure, all of the other avenues we just spoke about, let's talk about signs and symptoms of a heart attack. For someone watching right now,
Mm-hmm.
what are the classic signs of a heart attack that they should never ignore?
I know sometimes we feel that indigestion is coming, but I still would say don't ignore it. For an example, I like a lot of spicy food, being from Mobile. I love seafood. And one particular day, I kind of went overboard with my spices, and I had indigestion really, really bad. And I took Tums, anything that was, regarding to kind of clear up the indigestion, protonics, things like that. And over some time, over an hour or so, it really didn't subside. So I went to the ER. So again, yes, the outcome was that it was indigestion, but don't overlook that symptom or those signs. With men, we sometimes have that feeling of I have an elephant on my chest, or that crushing symptom of their chest. Women sometimes will have left jaw pain, left shoulder pain. And also, let's not overlook the sweating, shortness of breath. If you know on a normal that it doesn't, you're not out of breath when it takes you to walk from the front door to your kitchen or up the stairs, and then you start seeing some residual as time go on, then go ahead and get yourself checked out. Again, there is a difference in heart attacks and cardiac arrest, but sometimes those heart attacks, they would last a couple of months and you're not knowing that you're in effective heart attack, because we can't go on about our daily life without, as that artery is narrowing or filling with plaque or different things like that, depending on what health issues that we have going on. Some people have comorbidities, some don't, but definitely don't overlook that, especially for our women as well. But definitely the sweating, nausea, vomiting, jaw, back pain. Again, all of those things can show that, oh, well, it's due to something else. But if you see, I say, if you see that it's prolonged a day or so or over an hour, and you know that's not your normal, it would always be good to document that in a little tablet, or just always follow up with your primary care.
Wow. So you said something that I want to kind of just reflect on a little bit more.
Mm-hmm.
And that is how men and women can present differently
Mm-hmm.
with symptoms of a heart attack. Can you speak to that?
Yes. So, specifically with women, sometimes we may have the nausea, vomiting, we may have that jaw pain, back pain, a lot more indigestion. Or we could also have those sweats, and we may feel like early menopause or something. It's easily for us as women to overlook it and blame it on something else. But we are also at a higher risk as well. And women are becoming more undiagnosed than men, because there's so many other things that we can blame it on. Not to say men don't do it as well. However, theirs is a little bit more where they can notice it, where the crushing of the chest, they will always kind of say or that they feel like an elephant is on their chest, or they're having shortness of breath, or just difficulty breathing, period, all around. It's kind of like the number one and two symptoms that a man may feel. But with women, ours can start one area, lead to another, and we will always, as women, we do put it off on something else, thinking that is that, and definitely overlook those signs and symptoms.
So just to kind of sum up what you were saying, you talked about that radiating pain. It'll start somewhere and radiate maybe to the back or to the side.
Mm-hmm.
Okay. Very good. Women, pay attention.
Yeah.
Okay, so now, Carolyn, let's talk about heart failure, some of the signs and symptoms. What are some signs that someone's heart may not be pumping effectively?
So a lot of times with heart failure, one of the biggest things is depending on if you have a right or left side heart failure. We have two different sides. Right side can lead to one thing, your signs and symptoms. Left side would be in another. But if you have excessive extremity swelling, it can be some vascular swelling. Sometimes people may feel like, oh, this medication, or I'm having a lot of fluid buildup or things like that. But if your heart is not appropriately functioning and pumping out, it's bagging up. And when it bags up, then it bags up on that right side. I'm not going to go too much in details. However, it will bag up into your extremities. And then on our left side, when it's not filtering and the blood flow is not pumping adequate blood out to our lungs, then you'll have a lot of wetness on your lungs. The fluid will build up on your lungs. You'll start to notice where you're not able to lay flat, significant shortness of breath where you have to sleep in a chair or with sets of pillows, things like that. If you go to your doctor and tell them the symptoms that you're having, each side has different symptoms. So if you say, hey, I'm having extremity swelling, my legs, things of that nature, they may say, okay, well, let's go ahead, let's go get an ultrasound, see if you have peripheral vascular disease, or, they're going to narrow down to see what's going on. But like we stated, the vessels. And if you start saying, well, I'm coughing a lot, I'm short of breath, I feel like I have a lot of fluid on me, then they're going to know to proceed with the other side. And typically, one of the things that we do in imaging is have a diagnostic cardiac cath procedure, and that would determine your ejection fraction, if it's your blood vessels, or anything like that. They will move forward with diagnosing you with congestive heart failure.
Yes, I love it. I love all the terms. So ejection fraction, knowing what that percentage of what your blood flow, your output looks like is very important. And yeah, we won't get all down into the details.
But one of the things that they may say that would lead you to where they're wanting to see what your valves are doing, and is it pumping, is everything flowing appropriately, that your doctor may ask for echocardiogram. And then if they don't get good images, then you go to cardiovascular imaging and have a TEE, a transesophageal echocardiogram. And then they'll go non-invasive before going invasive, and then it may lead up into that cardiac cath, depending on what they are seeing through those exams.
And the severity of symptoms. So I love that you brought that out. So being able to diagnose all of these different symptoms, you have the echocardiogram, you have the TEE, and you have the cardiac cath. Cardiac cath is pretty much we believe that there is some blockage, and that's what we need to determine.
Sometimes they may do it as a diagnosis just to make sure everything is good and clean. Sometimes they may do a cardiac cath and your vessels look amazing, but that once they cross that valve and get your EF, that's when they'll kind of really say, oh, well, the echo said you were at 50%. Cardiac cath is more invasive. It's going to give you the more accurate. We see that we're at 45%. So if they're kind of going in between, or they're monitoring you month to month, you may eventually have that cath. Not necessarily saying you have blockages, but just to look at your heart function. And another thing, also in our radiology department, we are increasing a lot with our coronary artery studies and stuff. And so, in our department, we do a lot of coronary scans that we can stress the heart. So it's preventing patients from moving forward to invasive cardiac cath lab, decreasing infection, things like that from having exposure to a puncture. So you can go and get a CT done of your coronaries, and we would stress your heart by giving you nitro. We'll get your heart rate at 65. We want your heart rate at a set number. And then we'll stress it with nitro and do a scan. And sometimes that would tell us certain vessels, certain percentages. We can do FFR to see the flow and narrowing of those vessels. And a lot of providers are using that study in CT now versus going straight into the cardiac cath, because they could say, well, hey, that narrowing is not as bad as I thought it was. Let's treat with medical management. And then if it is worse than what they thought it was, then we can move on to the cardiac cath.
Oh, that was a brilliant discussion. I love that. And I recently had a patient who was in the office and was talking about she needed to have the stress test, and she was so nervous about it. And I was like, no, you're right there with them. They're going to keep you safe. So I like how you describe what is happening. So I'm going to make sure she sees this conversation. That was brilliant.
And that's what we do in CT, but in our cardiac nuclear studies, that's probably where she had the stress test, where we either put them on a treadmill, or for individuals who can't walk or run, we will have them on the bed, and we'll just have them doing like a motorcycle just to kind of increase their heart rate while we're stressing their heart at the same time. So we have a lot of non-invasive procedures that we try to do to solidify and hone in on, is it this, is it that, is it a terminal, is it, where we're going to go next before we start getting into the more invasive type procedures.
Love it. Love it. Thank you for clearing that up. That was brilliant. Okay, so this is why primary care visits, knowing your numbers and all of this truly saves your lives. Taking your medication every day. I will continue to say it all the time because it is just that important. Okay, now, many people use the term heart attack and cardiac arrest interchangeably. Can you explain the difference for us?
Yes. That is definitely one of the initiatives that I promote when I'm out in the community, teaching individuals that there is a difference. Like I stated on one of our medical minutes before, I like to talk about having a heart attack as a pumping issue. There's a blockage. Whereas on the cardiac arrest side, that is electricity, our electricity of our heart, which is our heart rate, our irregular heart rhythm, dysrhythmias, you'll hear those terms. And on the hospital side, that would be the difference in cardiac cath lab, where we're going in, we're seeing, are those arteries clear? What that flow looking like as a plumber? We're the plumber going in. But on the EP side, electrical physiology, that's where you'll go for the electricity, being the pacemakers, defibrillators, and things like that. So there are two differences. Yes, a heart attack can lead to cardiac arrest, but the symptoms are definitely different. We mentioned earlier about the signs and symptoms of having a heart attack, but unfortunately with cardiac arrest, there's no symptoms. It is emergent, it's immediate, and it leads to death if you do not respond promptly and effectively, which is why it's important for individuals to have CPR AD education. And that's where on the cardiac arrest side, that AED, which is automated external defibrillator. Defibrillator meaning that it's electricity. That's what we're aiming at. However, will it save your life? No, just an AED won't. But definitely the CPR, compressions, getting that blood flow going, that is what's going to increase the survival rate. AED is definitely an addition to it, but don't be surprised in the event that if it's not a shock of a rhythm, that it will tell you to continue compression. So,
okay. You're jumping ahead.
Oh, sorry.
Now, this is good stuff. This is good stuff. Okay, so heart attack, you pretty much have time to get to more treatment.
You have more symptoms, yes.
More symptoms. Cardiac arrest, it can be all of a sudden, and I always think about that football game where the football player, Damar, just passed out. That was a cardiac arrest.
Yes.
Okay, where he was about to walk off the field and he just dropped.
Mm-hmm.
Okay. So when someone experiences sudden cardiac arrest, now we're talking about the AED.
CPR.
CPR first.
Yes.
Okay. So let's go ahead. Let's talk about that. Let's say
Okay.
someone collapses in front of us. Walk us through exactly what a bystander should do.
Okay. First and foremost, you recognize that, hey, this person has dropped, whether you know that they are responsive or unresponsive. But you will assess them. You get no chest rise and fall. They're not breathing. You check a carotid pulse. You have nothing. Then you would immediately tell someone to call 911, tell someone to go get an AED, and you would start compressions immediately. In the event you are at a location where there's no AED present, just know that providing the adequate compressions will increase their survival rate. But just getting help, providing the hands-only CPR, that will increase their survival rate until help comes.
Awesome. Awesome. So what's a couple of things that we should have handy, say for instance, schools, churches, in the event an emergency like that happens?
I would say definitely you can always have it won't hurt to have an AED on standby within your organization. And before you purchase it, or even when you purchase it, learn how to use it. It's very easy.
Mm-hmm.
I have a lot of people, a lot of teachers that are afraid to use it, but it's automated. It's going to tell you exactly what to do. So you can definitely have an AED present, however, but just educating yourself, your environment, and your community on how to respond in the event of an emergency, and just providing the hands-only, doing the compressions the right way. Uh, would build that confidence for you so you can feel comfortable to respond. So if you don't have an AED, don't fret. You still are able to respond. If you feel like you're not in a good position or you cannot provide adequate chest compressions, if you find that person first, go ahead and get started. And when someone comes to help you, it's okay to say, hey, I'm going to let you take over and do these compressions while I go get the phone, or I go call 911, or I'll go get AED. Know what you can do and what your body can tolerate, because if they're not provided adequately, it's the patient that's going to suffer.
Okay. So I went ahead of myself. Okay. I didn't want to add that just yet. Technical difficulties, y'all. Okay. Very good. So, and we've had these conversations before,
Yeah.
Carolyn. So just to share with the listening audience,
Yeah.
why do you think people are afraid to do, or are they afraid to do CPR after they've been trained?
Yes, I find that out a lot. When I'm out in the community, let's just say certain housing authority areas or some communities where everybody wants to learn, they're trained, but as feeling comfortable and confident, it comes from them feeling like, is my community going to blame me? For instance, if this person is a victim of gun violence or have a stab wound or at some point becomes unresponsive and I provide CPR and they still pass away, are they going to blame me and say that I'm the reason? So it's a lot of fear. You have some people that are not aware that they're covered by the Good Samaritan law to know that, hey, if I provide CPR, and of course, we're going to crack ribs because our heart is where it's enclosed within our rib cage. That is to be expected, but I would rather live with sore cartilage than die, right? So when it comes down to women, we find that our women are not, they're not surviving out here because they have an increased rates of death from people not responding to them. Well, everyone, the women hearts are in the same place as the men. You may have a little extra tissue or some breast or something, but please save us as well. It's the same recovery. So you find people that are afraid to expose women, feeling like they're going to be sued and things like that. And so one of the things I share with my youth when I'm out in the community is teaching them other things to do with their hands other than standing around recording, because time is tissue. And in the case of CPR, time is oxygen. There's oxygen in our blood. We need to get that blood flow going to our organs and the rest of our body, our brain. You are important in this case. So do not fret. Don't fear. You won't be sued. Just feel comfortable within yourself. And also, it goes back to the training. Jennifer, I do have some individuals when they come and train with me. By the time you leave me, you've done over 100 compressions. And if you don't remember anything, my goal is the takeaway by the time you leave my office is you feel confident and comfortable with knowing that if I don't do anything else, I'm providing adequate compressions to save a life. And so I've had good responses from that where people, and that's one of my goals. That's a mission, to make people feel confident and comfortable, because that's the biggest thing. They, stand firmly on what you can do and knowing that your training was adequate. The positive way.
Yes. Yes. And you've certified both Pauline and I multiple times. So yes, the most thorough education that I've received in my CPR certification over the years. When you walk out of her class, you feel like you can save a life, and you will not be hesitant to step in if the need arises. So just wanted to shout that out. So since we talked about hands-only CPR and your training, I want to talk about your business, Pulse Finders. Yes. What is Pulse Finders and why did you start it?
Here at Pulse Finders, we certify individuals, healthcare, non-healthcare providers, youth, in hands-only CPR. We also provide individuals who want to be certified in CPR AED via American Heart Association. And for my healthcare providers, we provide BLS, ACLS, bloodborne pathogens, and we are really big out here in the community, raising awareness about cardiac disease, cardiac awareness, as well as teaching individuals, educating them, and offering tools and resources on how to respond in the event of an emergency. I founded the Pulse Finders back in 2019 in Georgia. But prior to that, me being a member of Birmingham Black Nurses Association, we partnered with American Heart Association for their initiative when they first kicked off the hands-only CPR. At that moment, when we were doing a lot of lock-ins, we was at a YMCA, we were at a lot of community events. I noticed that there was a lot of grandparents raising grandchildren, and it was a lot of false misrepresentation of cardiac arrest, and just a lot of people was not aware of it. And at that point, I made it my mission to make that a big effort. Even though we're for-profit, we were founded on community service. So I made that a big portion of Pulse Finders because a lot of people wasn't aware. And I wanted to be the face of that awareness and also provide that when we're out in the community at health fairs, because let's be honest, when was the last health fair growing up where you went or attended where someone was out there talking about cardiac arrest or heart disease and things of that nature? I don't remember it in my neighborhood back in Mobile. And I'm sure some of you all don't remember receiving that as well up here. So that I made that a mission and a purpose for Pulse Finders as well, to also receive hands-on training on site, but also just word of mouth and just getting out there, sharing with people. If you're not available at that time, if you didn't come to that event to get on the ground and get your hands dirty, well, guess what? Meet us at the office or give us a call and we may come to your organization, your church, and things like that. So it's pretty much how I got going. And now we're 6 years in.
Awesome. Congratulations on 6 years. So I've showing an event that you will be holding February 21st, this Saturday. So talk to us a little bit about this right here.
Yes. So a lot of you may not know, but the Pulse Finders are 26 and 27 Bold Grant recipients through the city of Birmingham. And our community outreach project is going to be where we certify 300 individuals throughout our Birmingham areas. We will be covering hands-only CPR. We will be even certifying individuals in CPR AED, offering Narcan, opioid overdose awareness, as well as stop the bleed training. We are doing our kickoff this Saturday, the 21st at our office, 1601 Fifth Avenue North. And we're starting off with our the divas of Delta Sigma Theta Sorority Incorporated. We are implementing hands-only CPR. We're offering it at 12 and 3, and we have a couple of slots. We have about 10 slots left at the 3 o'clock session. So I wanted to make sure that I posted this and made it available for individuals who may want to come out and sign up. And also, if you follow us on our social media platforms with Facebook, LinkedIn, or Instagram, the Pulse Finders LLC, we will be posting a flyer that's going to have a Sign Up Genius link where you can always go back and take a look at that link to see where our upcoming events are coming around the Birmingham area. We'll be at Smithfield Recreation Center. We'll be at North Birmingham Library once a month. So we're going to be out in the community getting our hands dirty, and I would love for you all to participate and come get certified. Come learn. Learn. Education is power.
Only power if you use it. So yes, please take advantage of this, the hands-only CPR. Our community needs it, and we need you to be there. So, all right, more to come on that. I also wanted to share some events, MedsPLUS Consulting, that we will be a part of this Sunday at the Love Fellowship Christian Church. We'll be talking about menopause. So for you ladies, the connection between menopause and heart disease, that is real as well. So join us for their Women's Fellowship, and it will be starting at 9:30 a.m. this Sunday. We also will be a part of a heart health event. And let me put that one up. And this is for men. It is going to be a men's health and wellness summit. There are going to be topics on many chronic conditions. We'll be speaking about diabetes and vaccines, but it's a full day. It's going to be taking place at St. Luke AME Church in Hueytown. So we'll also be sharing this on our social media as well, but just wanted to make you aware of what we have going on. Carolyn, I cannot thank you enough for being here with us today during February Heart Month and all of the valuable information that you share and with our listeners and the people that follow you as well.
Yes.
We would like to remind everybody to take advantage of this free education. It's valuable and it could save a life. At MedsPLUS Consulting, we invite you to break up with your pharmacy. If you haven't seen our media campaign for this month, it is Break Up With Your Pharmacy Month. If you don't have a good relationship, if you do, stay with them because we want you to get that good help from your pharmacist. But once again, we can be reached at 205-650-4636, or you can reach us on our website, medsplusconsultant.com. All right, Carolyn, this is our sister company right here. So you all make sure you all support Carolyn and the Pulse Finders. Show up this Saturday. Sign up for her CPR classes that are being provided through the City of Birmingham's Bold Grant, in which Carolyn was a recipient. So congratulations again, Carolyn, for that.
Thank you. I appreciate it.
All right, y'all. That is it for this week's MedsPLUS Medical Minute. And we hope that you have an awesome Monday. Bye-bye.
Bye.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.